Okay, good evening, everyone, and welcome to today's Scrutiny Children and Services Review Group meeting. My name's Councillor Lee Bridgen. I'm chair for the meeting. I'll just run through a few of the usual housekeeping notices. So, the meeting this evening will be live streamed to the public. Any exempt or private items on the agenda will be taken at the end of the meeting, and the live stream will cease prior to the meeting moving into private. There might be a short delay while that happens. In-person attendees are required to wear face masks on entry into the building and meeting rooms, but may remove them once seated. A recording of the public part of the meeting will be available on the council's website within 24 hours of the meeting. Remote participants joining the meeting using Teams, please turn your cameras on and use the hands up icon to indicate a question or comment. Turn microphones off. Turn microphones on to speak and off when finished. In-person attendees, please remember to switch microphones on when speaking and speak directly into the microphone and turn off when finished. With in-person attendees also, make sure you switch your mobile phones off or place in the silent mode. So moving on to item 1 of the agenda, which is apologies for absence.
Apologies received from Councillors Kershid, Moles and Joe Miles, the secondary school representative.
Thank you. Any other apologies for absence?
Yes.
Yeah. Okay, thank you. Moving on to item 2, which is to agree the minutes of the last meeting, which is on the 12th of January 2022. Thank you. All right, thanks. Any comments on the minutes? No. Okay, so we'll consider those approved then. Thank you. Moving on to item 3 of the agenda, which is disclosures of interest.
Usual interests, Chair. Queen Elizabeth School, Governor, Richmond Hill School, Governor, and the virtual school, Governor.
Thank you. I don't see any other hands up in the room, but I see a hand up on the screen. And I think that's Dr. Mohammed. Dr. Mohammed?
Yeah. Chair, I have the similar declaration of interest. I am school governor at Warden Hill Infants, Meads Primary and Grassmere Nursery School. Thank you.
Thank you. And just a further housekeeping comment for members joining via MS Teams. Could you please turn your cameras off until such time as you're needing to speak or present? Thank you. Okay, thank you. So moving on to item 4, urgent business. I haven't received any notice of urgent business.
None from me, Chair.
Thank you. Item 5, references from committees and other bodies.
None, Chair.
Thank you. Item 6, Chair updates. I have nothing to update upon since our last meeting, so I think we'll move swiftly on to item 7, which is the Children's Services Ofsted Improvement Plan, which is on page 13 to 35, and with, I think, Damien Elcock. Oh, sorry, Amanda.
Thank you. I just want to make one comment, if I may, please, Chair, just before I hand over to Damien, just to ensure that all committee members know, because not everybody had arrived, to introduce our DFE advisor, Clive Jones. He's observing this evening and with us, so that I'm just wanted other members to be aware, because he did have opportunity to meet Councillor Lee a little bit earlier, but not everybody was present and with us. Okay, thank you.
Thank you, Amanda, and welcome, Clive. Damien, thank you.
Thank you, Chair. Councillors. I'm here today to present our update report, our bi-monthly update report on progress on our improvement plan, and also to provide some feedback on our most recent Ofsted monitoring visit, which took place in early December. As you're already aware, we've got a comprehensive improvement plan in response to the January 2020 inadequate judgment that we've gradually been working through and been providing. Okay. Been providing you with regular updates on. Just wanted to highlight some key improvements since our last update report. When Ofsted visited us in January 2020, one of the things they commented on was that there was where our care leavers met with the people that support them, and also in terms of space for them to gather and meet each other and support each other, that there was more that we could do to make that space more accessible and more user friendly. We've now started supper clubs. They're actually called chilling, is that right? Yeah, chilling clubs without the G. That are every Thursday night at Limbury Community Centre. Gives the opportunity for care leavers to get together, meet as a group, also meet with people from the department. The opportunity to cook together, to have a communal meal together, and it's become a real focus point for the support for our care leaver community. As part of our evidence to Ofsted, we have to provide a whole suite of evidence under what they call Annex A. It's both documentary evidence, it's performance data, it's policies, it's procedures. It's a really complex piece of work that we do in preparation for each visit. And because we've got the full inspection hopefully coming up in, we expect immediately after Easter, we've got a huge piece of work going on to totally review that, to make sure we're putting the best evidence pack together so that they can see all of the good work that we've done as part of our improvement journey. We're reviewing that on a fortnightly basis to make sure that we're on track to deliver that. As part of our efforts to make sure that managers have all of the information and the data that they need to manage the work that's flowing through their service, we've developed these data dashboards for a range of different pieces of activity. Training for all managers and administrators to make sure that they are able to use these tools effectively has been undertaken in the last couple of months. My colleague Ali and her heads of service are holding weekly practice meetings with team managers to discuss good practice, where there's areas that we still need to improve, and to also look at the outcomes from our audit activity and make sure that we're closing the loop, make sure that anything that's identified as part of that activity that we're responding to and responding effectively, and ensuring that any areas for development and any areas to address are done so in a timely manner. I'm just cherry pick some of the highlights here. Our permanent workforce numbers are still increasing. And we now have a far reduced number of vacancies within the department. Our colleagues in commissioning have been successful in a bid for £1 million of funding from the DFE Children's Homes Capital Fund to redevelop Wigmore Hall into a specialist residential provision. It is subject to match funding. We're currently working on the business case for that, expanding the business case that we use for the bid, but it'll effectively give us the ability to place children 14 plus with complex needs, social, emotional and mental health needs, more locally rather than relying on private expensive providers out of the area. And that will make it easier for us to make sure that they remain within their local community networks, which has always been seen as a strength in terms of making sure that they have achieved good outcomes. Our work to reduce caseloads across the service to make sure that our social workers have manageable caseloads and can dedicate enough time to each individual child that they're working with has been very successful. And average caseloads across the service now are pretty much at the level we were hoping to achieve, which was 18. The average across the service is currently 19, but some services is actually below 18. We had another successful bid for additional DFE improvement support to strengthen our quality assurance audit activity, and that's been invested to bring in some practice development capacity. So these are people with significant experience of social work practice who can support our staff, our managers to develop their skills so that we're able to make sure that the quality of practice is improving at a greater pace and it's becoming more consistent. And then we've started some background work alongside our Ofsted improvement activity around the child-friendly town strategy, which is a fundamental part of Luton 2040. Through the Children's Trust Board now, all of our Children's Trust Board members, so that's our key statutory partners, so education, health, police, the various providers of health services, so like ELFT, CCS, the CCG as the commissioners, and some of our schools have made pledges as to how they're going to support our aspiration to make Luton a child-friendly town by 2025. The other piece of feedback is around our third monitoring visit from Ofsted, which took place on the 8th and 9th of December, and that was focused on our support and our services for children in need of help and protection. We had 2 weeks' notice, so that did give us a little bit of time to prepare. And they published a letter which is appended at Appendix D for you to consider. But just to give some key highlights, they noted that there was progress and improvements in services provided since 2020 when they came and did the full ILEX inspection. They did note an improvement in the quality of practice, but they still felt there was more that we needed to do around the consistency of that practice. They recognised the financial investment had been to increase capacity within the service, which has allowed us to reduce caseloads and therefore give workers the time that they needed to make sure that they achieve good outcomes for children. Social workers are visiting children regularly and they're making an impact and they're helping to keep them safe. We are now delivering the right level of social work intervention for the level of risk that we assess within each individual family. That was one of the challenges that they gave to us during that inspection in January 2020. We've still got some work to do around the quality of our supervision of casework by frontline managers. There's been improvement, but it's still not consistent enough, and that's something that we've invested a lot of time and effort in since that visit in December. And our most recent audit activity is showing that actually our practice is becoming more consistent, and it's actually becoming of better quality too. Children's plans. That was another challenge that we had, that they weren't specific enough, they weren't outcome focused enough, and making sure that services were delivered in a timely way to make sure that children's needs were met effectively. And what they found in the visit in December was that more recently produced plans were timely, focused, short, punchy, that they did not have vague actions in there, and that everyone involved in the plan knew what their responsibility was towards delivering the plan. Disabled children are receiving good support, and based on some feedback we had from an earlier visit in April of last year, they noticed that the ability of social workers in that service to communicate with children who had additional communication needs had improved significantly. That was as a result of some targeted training that was delivered to that cohort of staff as a result of the feedback from Ofsted. Also, they recognised that the leaders within the service knew that our workforce is the most critical resource. We've got a new 3-year strategy that was signed off late last year, and central to that is the development of social workers through our Social Work Academy, and I know that my colleague Daniel is here to speak to that later on today on the agenda. And lastly, that as leaders, we know what the strengths and weaknesses are of the within the service, and that where there are weaknesses, we've put in additional activity to make sure that those weaknesses are strengthened, so we know ourselves well. The upshot of all of that feedback is that Ofsted have now decided that rather than continuing with 3 monthly monitoring visits, we are now ready to have our next full inspection, which will determine whether or not our grading of inadequate changes. They've said that won't take place before Easter, but it's likely to take place soon after Easter. That's all the forward information we will get. We will get a call on day one, and that will trigger a 3-week inspection. 3-week inspection where the first week they're off-site looking at the evidence we provide them with that I discussed earlier. And then they will be on-site for 2 weeks. And rather than in the monitoring visits where it was only 2 inspectors. This time round, it's a larger team of 6 inspectors, including with one of those being an education inspector. So a much more substantial piece of regulatory activity. We're well underway in terms of how we're preparing for that. I'm responsible for the improvement team, and we've been coordinating with colleagues on the operational side of the services, meeting with them regularly, making sure that we're gathering the best evidence so that we can present that to Ofsted to demonstrate the difference that we've made in the last 2 years. That's my summary of my report. There's some appendices there with the reports from the most recent Children's Improvement Board and also the monitoring visit letter for your consideration. Thank you.
Thank you, Damon. Before I open up to questions from the floor, and had Terry raise his hand already, I've got a couple of questions myself. On page 14 of the agenda pack, the first bullet, obviously it alludes to the challenges that we're having locally, as well as, you know, general problems nationally in recruitment of social workers, and that's, you know, the challenge that we're facing is I guess further alluded to in the table in Appendix B on page 26. Now I guess my question is, well, I'll separate my questions out actually. So the first table, actually, sorry, the table's on page 24. So for December, we see that we have reduced the number of unfilled vacancies to 8. But during the same period, we've had 4 permanent staff, social workers leave, 3 permanent recruited, and 1 agency recruited. So we've had 4 permanent vacancies go, but we've also had a net change of 0 in terms of who's come and who's left. So my question is, what's happened to the 4 vacancies? Surely there should be an additional 4 vacancies there, or have those positions been lost?
That change isn't from November to December, Chair, it's from July to December. So the vacancy rate, the number of vacancies in July was 23, but by December is 8. But just to be clear, they are vacant posts where there is no one in that post. So, whereas we may well have agency workers in a post, so we don't consider that currently vacant, but we are still actively recruiting to it, if that makes sense. So I mean unfilled posts, for want of a better description. But I think my colleague Ali, who's the Service Director for Operations, wants to come in on that, if that's okay, Chair.
Sorry, yeah, sure.
No, I was just going, I wasn't sure if Damien knew that point really, but the way it's recorded is that we record vacancies as being completely empty, if you like. So they don't have anyone sitting in it. But just to add to this, I have a monthly, what we call a star chamber, and every part of the service I meet with the service manager, the head of service, and the team managers. I also meet with HR, and we have a project team that are working specifically on targeting all of our vacancies and our recruitment. So that gives us kind of reassurance that we are absolutely advertising, recruiting, interviewing, and we liaise across with Connect to Luton to make sure that everything is connected across, so that we're talking about vacancies. It also means that if we've got really good agency staff that maybe are coming to an end because we've filled their post, we're able to encourage them to stay in Luton and maybe move to a different area of the service. It means that, I mean, and Daniel will talk more about how we then match newly qualified workers to go to the right vacancies and how we build on that. But the Star Chamber focuses on, and there's a team of us, and we go through the whole round of the service every month, and it kind of gives us that reassurance that all of our systems are talking to each other. And so that I wanted to give you that detail, because it's quite specific in these reports, isn't it, in terms of how we record it.
Can I just come back in, Chair, as well, just to make it more apparent? If you look at the July 2021 figure on that table, we had 191 social work staff in post against an establishment of 214. So there was a deficit of empty posts of 23. But in December 2021, we actually have 205 staff in position against an establishment of 213. So, and the 205 is the combination of the 144 permanent staff and the 61 agency.
Okay, thank you. On the same table, obviously, we've got this, I guess, quite important figure in relation to percentage of agency staff. And I understand that we had previously had an aim of being at I think it was 10% by the end of January 2020. Sorry, by January 2023, but we've changed that to 20%, obviously, because of the challenges we're facing. My concern is obviously that, you know, yes, it's a national problem, but we are, in terms of these figures, we are largely, if you like, stagnant in terms of not eating into that. Are we? How certain are we that we're actually going to achieve this wider figure?
Yes, Chair, if Daniel takes that, because he's been working on this. Yeah.
Yes, thank you. We've developed through the academy, we developed a strategy of how to attract new permanent practitioners to Luton, and one aspect of the changes we've made in the social work academy is to introduce the assessment centres, and those are the opportunities for us to reach out to many students and potentially future employees of Luton. But also we strengthen our links with the university as a way of reaching out well in advance, as we've done, for example, this year in January. We've increased our presence with the university. We sent out our senior practitioners to give lectures and engage with students. And we are very optimistic, particularly for the August recruitment drive, that we'll have a large number of students that are coming to the end of the academic year that will apply for our vacancies. We already, in the first recruitment drive we had this January, we have a number of 22 students who've expressed an interest. They haven't finished their studies yet, but they have expressed an interest to join Luton. So we are very optimistic about the recruitment drive in August.
Okay, thank you. Thanks, Ralph. So I'll open up to the floor now. Terry had his hand up.
Actually, I just want to follow on from that. Are you telling me then, in my little confused brain, that we are still employing agency staff from, not those already here, but we're employing more? Oh, come on, somebody answer.
We are still employing agency workers where we need to, so that we have enough resource to deliver the services that we need to deliver. Because ultimately we're delivering a service that is there effectively to safeguard and support vulnerable children. So we need a certain level of resource. If our permanent recruitment isn't achieving the level of recruitment we need, then we need to fill in those spaces sometimes to make sure that we have the right skills to deliver our core task.
Chair, can I also respond, please? Thank you. Good evening, Councillor Keynes. Yeah, you are absolutely right, but you will remember, I'm sure, that we brought and we're going to talk more about the Social Work Academy, but a fundamental model of the Academy is that we do use agency staff to support newly qualified staff. So and Daniel will talk about this, but a newly qualified member of staff has a year to consolidate their practice. Rather the same as health and police, etc. So in police, I think they call them probationers, but that we have a first year to practice, and during that period they have a period of different levels of caseload and different level of complexity. So our strategy to enable us to recruit and to actually recruit permanent staff and grow our own was that we would bring in newly qualified, but we would support them with very well experienced and skilled agency staff who are very committed to Luton. And it's a national position that we are all in health, in social care, that there is an element of the workforce that we have to recognise that like to be within an interim role. So it's how do we use that to our best advantage? And we're finding that actually we're using that in our academy to the best advantage, which means we keep them for a period of time. They work alongside our newly qualifieds, and as soon as our newly qualifieds get to a place where we're confident and they're confident, they'll be able to take those more complex caseloads with careful oversight with the academy. Then we release agency staff. But don't forget also, Councillor Keynes, I'm sure you'll remember that you agreed to significantly increase the social work establishment. So that does mean that actually we increase the overall numbers, and we have to then recruit to those numbers. So we are seeing a better position, but it's in the context of the round, really. So I think we will always, all children's services nationally will always use agency staff. There's a place for interim staff, but obviously we need to flip the balance that we have more permanent staff here than interim, which is, of course, what this trajectory is showing.
This is a bit like Catch-22, isn't it?
In some ways.
Yeah. It just seems strange to me that one of the other reports we got tonight saying we're cutting down on agency staff, and you employing one or two. So it doesn't seem to gel.
So, Councillor, you're right. It's a complex situation, and we probably take it for granted because it's our day-to-day business, if you like. And it does feel like overall the position and the trajectory we're very clear, is to reduce the spend of agency staff, to secure permanent staff, social workers in Luton, and to make sure that we're wherever possible encouraging Luton citizens to be able to practice in Luton. So that's kind of grow your own, encourage people to come through. So if they're interested in a social care career, that they might come through our family partnership service, through our adult services, that we give them opportunities to be able to come and go to our local universities and then come and practice here. So, but at the same time, so we're very clear about that. But at the same time, during that period, in terms of the long game, we actually do have to invest in our interim workforce, and they are very important to us because they also keep our services being delivered. So, and some of them, quite a number of them, come here, kind of try us before they buy, and a number of them actually do stay and they become permanent staff. And we have a really fast strategy that if we, they come and they work here, and actually we can then turn them into permanent staff. And we've been really successful with actually bringing people. Some of our senior managers have followed that route. And come from an interim position into a permanent position, and obviously then reach out to say actually they're settled, they want to be here, they've made a conscious choice of this is what they want. So it's a mixed economy is probably what I'm saying in a roundabout way, with an absolute drive to make sure that we have the higher percentage of permanent social work staff.
Now I've got rid of that. I'll ask the other little questions I was going to ask. Page 13, bullet point 3, it's click. Click.
Councillor Keane, it's a brand name. So it's a brand name. Click is the name of a dashboard. It's a way of describing data. So it's actually just a brand name of the system, Click. So really the dashboard is a way that we organise, pull the data through from our reports. So we have another system called LCS, which is a Liquid Logic. It's another brand name. So we have the data systems that we record all our information on. We create an electronic children's file, but because we're working with so many children, we've got KPIs that are key lines of performance indicators that we measure, so our children being seen. The quickest way to do that is to create what we call a dashboard. So when we are on our electronic systems, you can quickly have a look and see the red alerts. So those children, if you're a manager, those children that haven't been visited show up as red, and that then means that we can drill down on that data to say, right, let's you need to prioritise this. And we can see the greens where we've got really good performance, etc. But it's a brand name called Click. Does that help?
Well, yeah, okay. It's all foreign to me anyway. The other thing is just the Limbury Community Centre supper club. Are you intending to enlarge that throughout the town, or is this just going to be Limbury?
It's being held at that location. It's not necessarily about running it in lots of locations. This is for the care leavers of Luton, and it's about having one space that's large enough for a large number of them to get together all at once. So it's not as if this is for a specific local community group of children. Our care leavers are spread across the whole of Luton, and it's about having it in that one location because that was the best, in consultation with them, that was the location that was identified as best meeting their needs.
Again, we support them to get there as well. We support them to travel there, and we support them to get home again. And we are in talks with other we've recently met with Toku to talk about how we might be able to engage some of their space. I think it's COVID has restricted us in some ways, and so that space allowed us to properly control all of the COVID restrictions, etc., and make sure it was a safe space. But yeah, we as Damien said, it's about a cohort of young people that want to come together, have a bit of supper, and talk about issues related to what it feels like being a care leaver. And it also gives the opportunity going forward for our members to meet. I know our lead members are very keen to be going to meet our youngsters.
I'm going to the next one and the one after. They've invited me, so I'm really excited about that. So the first one's on Thursday, so I'll certainly feed back. And we're going to the Care Leavers Forum as well, the first one that's coming up. So yeah, feedback to you, Mr. Keynes, as well. Perhaps you can join us at some point.
Free meal there.
Apparently.
Oh, that will finish it off.
Thank you. I've had I don't see any hands up, so I'll carry on with another question that's come to mind. Again, sort of linked to the agency staff and side of things, but rather than looking at the figures, I'm more curious about the experience. So what I mean by that is I understand that we're dealing with children who have experienced a lot of loss in their lives, and possibly families who have also experienced that. And I know that part of that sort of care experience is getting to know the social worker. I've had it explained to me that a social worker's job is actually to know you better than you know yourself. So I'm conscious of the effect that part of the way through someone's journey, the impact that the loss of a social worker could have. And do we have any, I guess, come back to data again, but do we have any data on how many times on average people have to change social workers and what that impact is?
Yes, we do. I don't actually have it to hand, Chair, but it's certainly something that we can provide at a later date. It is something we're acutely aware of because we are absolutely recognise that it's in developing that relationship with a trusted individual who through your time in care or through your time receiving support from the council is really, really important. It's a little bit, going back to Councillor Keen's expression, it's a little bit of a catch-22 because on the one hand we need enough staff to deliver the services we're required to deliver, which does mean that at the moment we're relying on agency staff, but we also recognise that there is a risk that they will move on after a short period of time or after a longer period of time. What I would say is the evidence we have is that a lot of our agency staff stay a long time with Luton. They stay 2-3 years plus, which is unusual. We're also working on how we can make sure that transitions between social workers are effective, so that young people, whilst there may well be a loss, also get to know that new social worker either in the company of the departing social worker or in a way that makes that less impactful, less negatively impactful. So, for example, social workers writing to the child to let them know they're leaving and introducing them to the worker who they're going to be, etc. We know it's an area where there's more that we need to do, but it's something that we've been actively working on to make sure that that transition process is as smooth as possible, because we do recognise that added loss may have an impact for that young person who's already experienced significant loss.
Thank you. Any other questions from the floor? Jeff?
And it refers to bullet point 6. It says support children receive does not always result in a quick enough improvement in their lives. Can you expand on that a bit, please?
Sorry, Councillor, are you sure it's on page 13?
Sorry, 15. I beg your pardon.
Thank you.
Awfully sorry.
That's okay. Well, Ofsted sampled a number of cases during their visit, and some of them they felt that the impact could have been. Sorry, which bullet point is it? Is it the third one? Sixth. Yes. What they were saying was that whilst they were receiving support, sometimes it didn't make a difference quickly enough, and there's a variety of reasons for that. But this goes back to the issue about the consistency of practice. So they recognised there was an improvement in the quality of practice, but that the consistency there was still more that we needed to do. So I'm not sure if there's anything you want to add there, Ali.
Yeah, I mean, it's I guess a lot of the information that Ofsted fed back to us, we also gave in the first instance to Ofsted. So part of the monitoring visit, and it's a sort of key line of Damien's work, is that we give them where we know our gaps are and how we're working in terms of improvement. And so that then gave us that, you know, we knew that our care plans weren't strong enough. And there were a number of reasons for, you know, for that impact, really. Were we able to demonstrate the impact that we were having by looking after children? And we could see, and the feedback from Ofsted was that actually when you talk to children and you talk to foster carers, that their outcomes were really good, but we weren't demonstrating strongly enough on the child's file what support we were offering. So we needed to strengthen the way that we were recording, and so that the child and their family and the foster care family could see in the plan, and they could see what their trajectory. And that includes the independent reviewing officers. Were they also strong enough in that plan? So since that visit, we've been working hard on how do we improve the work that we're doing, and it's demonstrated on the child's file to actually, so you can see the forward trajectory and our aspirations for those children. So part of that is us saying, look, this is where our weaknesses are, and us then saying, and this is what we're doing about it. And we've been working hard in that area alongside with the support of the improvement team and then the quality assurance officers to really help our staff and encourage them to strengthen their practice and to demonstrate on the child's file that strength of oversight and trajectory and aspiration for our children. We've also invested in that area. So we also have an education psychologist who specifically works with foster carers and children, just in terms of that oversight and ensuring that we have got a good trajectory of the care plan. We're thinking about the emotional impact, and we work really closely with the virtual school to make sure also that their education plans, if they have any educational health and care support needs, are brought together. So we've started to really strengthen how we come together and record that on the child's file, but we also come together as a team to make sure that we're wrapping around those children. So I don't know if that sort of helps explain it a bit more.
If I'm hearing what you say correctly, it's not a question of resource then?
It was, and it is, and the council have invested in those areas. So part of our demand-led funding, our DFE funding, has meant that we've been able to, and our investor save has meant that we've been able to add more resource into those areas. But we also need to work closely with our partners in terms of health, education, police, etc. So we need to also draw on their their resources to make sure that we get the best for our looked after children. So we always want more resource, don't we? Because they're our children and we want to spend the most and do the best we can for them. But it's about also making sure that we get best value. We talk together, we create a really good team response, and we're working hard to identify any unmet need. So it was about resource. In 2020, we then had the investment, and now it's about making sure that we're pulling on our partners. And a lot of that work is sort of being directed, I know, through the Corporate Parenting Board. So that kind of oversight and challenge in terms of high support, high challenge from the Corporate Parenting Board will bring that to the front in terms of how we are delivering those services together. That support, not just for social care. I don't know if Amanda.
I think that's a very comprehensive answer. I think there is no doubt about the corporate investment and the support, and everybody will be very mindful of the emergency budget and the actions that the local authority had to take, and some of the very, very difficult decisions that led to the closure of our children's centres. So what Ali is referring to in particular are those children with probably the most complex of needs, and what I think that Sally's on the call as our Director of Public Health. You know, what we have got to work together, and Ali made reference to the role of our partners, is very high quality universal provision for all children, and then the ability to have properly targeted provision that helps children have the right services at the right time in the right way. And work is underway, you know, under the umbrella of the Children's Trust Board to ensure that that's in place. But the levels of demand, particularly around children with complex needs, mental health provision, you know, the demands from health or on our health providers for health visiting services. You know, we're in a complex landscape, aren't we? So I think we've got to track that requirement for resource very, very carefully, and then use our resource in the most effective way, because otherwise you're responding to children with the most complex needs, and actually all of the evidence says that if you can invest properly upstream around good quality prevention and then good quality early intervention, you will reduce that high complex need. That's why we've got some of our important investor save areas. So we've taken forward, and Scrutiny have previously had, for example, our edge of care service model. Now, the cost avoidance of that service in under a year is over £1 million. We haven't created a saving. We've avoided spending that and avoided increasing our overspend. So there is always more that we can do if we can get our investment in the right way. So I think it's an important question, and one that Scrutiny, you know, should continue to ask and challenge on. Thank you.
Thank you, Councillor Lovell.
Thank you, Chair. I just wanted to commend the team for the great work that's been done since the Ofsted visit and the journey so far. You know, well done, and good luck for the next part of the journey. And I'm sure that will come out well for our children in Luton. So thank you.
Thank you. That's much appreciated on behalf of everybody. Thank you.
Councillor Kershid.
Thank you, Chair. I just want to ask, I would add what my colleague has said, and also ask, when is the next inspection? I know it's after Easter. Have we got a date or anything?
Thanks, Councillor. We don't get advance notice. They literally will call us on a Monday or a Tuesday and say, we're coming. and that will be the start of the first week of that 3-week process. They've given us an indication it will be after Easter, soon after Easter is what they actually said. So we're anticipating it's going to be between Easter and the May half term, the late May half term, but it may not be. We genuinely don't know. They don't give us advance notice. They call on a day, and then the difference has been with these monitoring visits is they're slightly different because we're an inadequate authority on an improvement journey. They do give us some advance notice, but a full inspect. Other local authorities aren't inadequate, and us ourselves for a full inspection we get no notice at all. We just accept the phone call on day one. Yeah.
That another question was I've thrown my thought now. I think I've thrown it. I was listening to you. And if I come back, Chair, opportunity.
Okay, thank you. Any other questions? Don't see any hands up. Oh, Terry.
Sorry, just following on. You're saying Ofsted will be sending in about 6 people this time?
Yes, that's correct, Councillor. It's a team of 6 ordinarily. That's the standard size. It can be larger for a larger authority, like a large county council, or it can be slightly smaller for a small unitary, but I wouldn't expect it to be any less than 5.
Just really, they go from 2 to 6. Is there a reason for this? It sounds a bit ominous to me.
Yes, there is a reason. A monitoring visit looks at a very small focused area of practice. On this full inspection, they will look at all of our practice, all the way from early help, all the way through to care leavers, adoption, fostering. So they'll look at every single part of the service.
Councillor Waheed.
Thank you, Chair. I've just remembered now. When are you going to feed back, update us after the inspection?
Okay, so that there's an agreed timeline. The finalised report from the full inspection visit arrives 30 working days after the inspection concludes. So it very much depends on when the inspection is, but we expect that the report will be available sometime June, July time, we think. It could be earlier if they come early in April, so it could be late May, but it's there's a process whereby so many days after the visit, they provide a draft copy. We then get the opportunity to challenge it for factual accuracy and raise any concerns. Then they send us a revised version. Then there's an opportunity for us to raise a formal complaint if we want to, but that's very unusual. And then we get a copy of the pre-publication letter, and then it's published. But it's the timescale that they work to is 30 days from the conclusion of the visit.
Thank you for that, and I wish you best of luck.
Thank you.
Sorry. These 6 people that are suddenly going to appear, I'm a bit concerned because the last paragraph of the Ofsted report letter to you was there is more work to do to ensure that the improvements in children's lives are achieved quickly enough. And there they're suddenly sending in 6 people. Are we not going down the right road?
It's not that they're sending more because they're concerned about how we're doing. That's the standard size. So for the inspections, there's a framework that they set out with guidance, and in that guidance for all standard inspections, it's a team of 6 inspectors, irrespective of whether you're a good authority or an inadequate authority.
Okay, I see no other questions in the room or hands up on the screen. Any comments? No. Okay, so just looking at the recommendation, I think it was just to consider and comment. So I think we can consider this item closed. Thank you, Damien. Thank you.
Thank you, Chair.
Okay, so we'll move on to the next item in the agenda, which is item 8 on pages 36 to 119 of your agenda. It's children's oral health and child healthy weight, which is being covered by Michelle Bailey or Sally Cartwright. Sally?
Yeah, Michelle's going to talk through the paper and I'll chip in with it with any updates or answer any questions with her afterwards. Thank you.
Hello all. I'm Michelle Bailey, Senior Commissioning Manager for Public Health Team. I'm updating members on the progress of the Oral Health Needs Assessment, our commissioning of services following the assessment, and our Child Healthy Weight Strategy. Also to update members on the sort of current picture of our children's sort of dental health and weight. If we start with oral health, and then I'll move on to the healthy weight. Oral health's a key public health priority. We undertook a oral health needs assessment in 2020, which has been signed off to give us a picture of our young 0 to 5's dental health. From that, we've developed an action plan to show sort of our priorities and how we're going to recommission our services. Some of the key findings from the needs assessment were that our children at age 5 have some of the highest levels of tooth decay nationally and in the east of England, and nearly 38%. And also the severity of tooth decay is quite high and above the national average. Our children have nearly 4 teeth affected. Other key findings showed there was higher prevalence in certain wards of Chorley, Saints, Biscuit and Dallow. So some of the areas that we'll be focusing on. And there's a significant relationship between ethnicity and dental decay. So we have focused some of our areas of our services that we're going to recommission, not only due to the findings from the needs assessment, but obviously COVID's had a big impact on our children's teeth. They've had access to unhealthy food, not being at school for certain periods, and also the closure of the children's centres had an impact on how we kind of deliver our services. So some of the things that we are focusing on are and where we've recommissioned and had to redistribute some of our funding. With Flying Start, we've commissioned some community link workers, which one of them is an oral health champion, but one of their key priorities is oral health and getting those key public messages and education and awareness to families and children. We've recommissioned community dental services to provide supervised toothbrushing in our early year settings, focusing on the wards I've already mentioned, and in the top 10% most deprived sort of areas, and our maintained nurseries. So they'll go in and they will run supervised toothbrushing sessions and train staff up to then have that daily toothbrushing with our early years children. They also will be have provided training, education and awareness to professionals, to some of our GPs, our school nurses and also to sort of families, to notice the signs of tooth decay and to keep those key messages and key interventions in place. The other areas that we focus on are within our Healthy Child programme. Our current providers, Cambridge Community Services, but they provide our health visitors and our school nurses. So school nurses are going into reception and providing those interventions, trying to get some of the behaviour changes for those children to kind of understand at an early age and making the right sort of choices with regard to kind of their packed lunches, their school dinners and their kind of healthy eating. They also will, at those kind of in assemblies, will give out sort of toothbrushes and toothpaste, because one of the key findings in the needs assessment was any opportunity to provide some fluoride intervention, so just to get fluoride into the mouths of our children. And then for our health visitors at our 12-month check, they'll be, when they're doing their face-to-face visits with our what we call Universal Plus families, or Universal Partnership Plus. So they're more sort of complex families that need a higher level of need. They'll be going out, giving out the key public health messages, healthy eating, and actually providing toothbrushes and toothpaste. So we've made sure we've got some adequate funding that we can actually provide those sort of consumables. We also provided some toothbrushes and toothpaste packs to refugees to kind of to make sure it was all linked up. So that's kind of oral health. If I move on to the child healthy weight, and then I'll take sort of questions after that. So child healthy weight, there's a child healthy weight strategy that was agreed by executive in June 2020. It runs to 2023. There's an action plan that sits underneath it that we are in the process of reviewing and updating following some sort of concerns that have been raised with our current sort of picture or current information of our children's weight at the moment. So again, a key public health priority. Children that are overweight have a massive concern, not only for their health, but their mental, their physical health, but their mental health as well, and it impacts on their education. They grow up to be sort of overweight teenagers and adults. So that early intervention and prevention, I think that Amanda spoke about earlier, is important at all levels. But they're obviously, our children are more susceptible and increased risk of cardiovascular disease, type 2 diabetes, asthma, cancer, and other sort of comorbidities and health concerns. So it is a real concern and worry to us to make sure we have the right strategy and the right prevention and intervention measures in place. Our strategy is also linked to our strategic vision for sports and physical activity. Obviously, there's a key link between physical activity and healthy weight, and also to our food plan. So again, there's a link between healthy eating, healthy weight, and oral health. So they're all interlinks. That's why the paper sort of covers both. We've also had some of our schools reporting an increase in the children coming back to school after lockdown and after Christmas of being more overweight, and some of their siblings that may have been picked up as overweight before are overweight now as well. So we have some sort of proactive head teachers that are very concerned and trying to engage the parents and our wellbeing services to offer some support. So obviously COVID had a big impact on children's health and wellbeing with lockdown. Some of our families don't have access to garden or outdoor space, so there's lack of physical activity, and obviously that access to unhealthy sort of sugary foods as well. So we have something called the National Child Measurement Programme, which was paused last year due to COVID. There was only a small sample for reception children, so we don't have enough adequate data for 2020-21, but previous data from 2019-20, our levels of children that were in the overweight category and severely overweight category were one of the highest in our region. So far, that programme has restarted. It restarted in September, and in my report, we'd only had referrals or data for November to December, and we'd seen an increase in number of children that were in the severely overweight category. How the measurement programme measures, way of measures children works out their sort of BMI, they work it out into the child's like centile. So the overweight category is any child that's over the 91st centile, If they're over the 98th centile or 98th to 99.6, they're in the severely overweight category. And then we have some children that are on the 99.6 centile, which they do fall under severely overweight category, but they are of the highest of that sort of category and really need some health intervention, and are sort of tier 3 services. So there's a dietetics or diet and nutrition team at the hospital that generally they would get referred to, but we've got increasing numbers and we're not sure that that service can actually cope with the demand. So we're looking at ways of how we can support these children holistically with a sort of multidisciplinary team approach that includes our sort of wellbeing services, which have our child weight management programs, but we have some behavioural services in there, family therapists, dietitians, paediatricians, to make sure we offer the right levels of support for children. So currently, say the National Child Measurement Programme's restarted, and we're seeing we've had some more referrals, I think, come through sort of January, February, and increasing numbers in that severely overweight category. The picture is the same nationally as well. So there was a national report for last year, which showed an increase of childhood obesity, and it showed the biggest increase since this National Child Measurement Programme began in 2006. So it's not just a Luton picture, and we don't know at the moment, because we don't have the full data, how we are in compared to our neighbouring authorities or nationally. We won't know that until all the data has been collated. I think that's everything. Has anybody got any questions or anything else you would like me to clarify?
Thank you. Terry, could you have?
Yeah, I've got a couple of questions. Big mistake closing the children's centres. We all know this, and I think we all were sorry it had to be done, but I think we could have done something to alleviate this. Never mind. Teeth decay. Is it up to the schools now to pick this up?
No, we measure the tooth decay. We have a dental epidemiology survey that goes out and measures children's fillings, missing teeth, level of decay. So they go out every other year. It's not just for the schools to pick it up. I think the school's responsibility is kind of to make sure they've got healthy eating policies, they've got like healthy lives approach, and encourage that sort of toothbrushing. So we were trying to encourage the toothbrushing, effective toothbrushing at an early age, in an early years setting, so children get used to brushing their teeth every day.
So I'm still not sure who picks this up. Is it up to the school to bring these people in to do these checks, or is... Come on.
No, we commission, as a public health authority, we commission an NHS trust to go in and do our surveys, because it's a public health statutory duty that's carried out. And then we commission other services, so like community dental service to go in and provide supervised toothbrushing, or support the staff to then provide that toothbrushing. But that's in an early year setting, and then the school nurses will go in at reception and provide that. Sally, did you want to come in?
Yeah, just follow up on that. So the needs assessment shows us what our rates of dental decay are across Luton, and we know risk factors for dental decay, but we don't know by school or by setting the levels specifically to that school. What we can do is commission services to address that universally and targeted more where that we know that there is likely to be more decay, but it's not specific to the child. So the the school nurses will be doing their actions that we've commissioned across the school, but not on a child by child basis based on their decay levels, if you see what I mean. So we know the risk factors and we know the levels across Luton, but the actions aren't specific to the child, they're specific to the setting.
I'm sorry, but I still don't quite understand. Where are you getting these figures from then? I mean, you seem to be relying on, well, I don't know what you're relying on, to be quite honest.
We get our figures from our dental epidemiology survey, which we commission as a public health authority. So they will go in and do a sample of children every other year. There's a prescriptive list and of how it needs to be undertaken in accordance with public health guidelines, and that works out kind of the levels of tooth decay and the levels of and the prevalence as well. And then some of the other information within the oral health needs assessment was gathered through other public health monitoring or data that is collated and that we have access to.
So if I understand that correctly, so the data for the epidemiological study is based on I guess a cross section of children who are reviewed for their levels of tooth decay, based also on their lifestyle factors, and then that's, I guess, ratioed up to if you like a population the size of Luton. Is that am I understanding that correctly?
Yes, and we know through national and local data the risk factors for decay, so it's more likely to be in deprived areas. So therefore we can have a universal across Luton service that we commission and additional focused work in the more deprived areas or the areas that are likely to have greater decay.
There seems to be an awful lot of commissions being done here. Surely when we had the children's centres, it was nowhere near as expensive as this.
We still had to have we still had to commission a dental epidemiology survey. We're just in the process of recommissioning that. So I'll give that, the cost of that is about £15,000 a year to us. We commission that jointly with Beds and Milton Keynes. So that's a statutory service we have to commission. Actually, we have had to work out how we commission services and had taken a different approach, and we've had to make savings to our oral health as well. So so we don't we commission community dental services, which we commissioned previously, but we've asked them to do have a different approach, and we are trying to take what we call a health in all policies approach, where it's everybody's responsibility to make sure there is good oral health and that children are aware of the need for toothbrushing, access to fluoride, and kind of that healthy eating. So some of that is not necessarily a commission service, that is just part of our action plan and kind of how we work with our partners. And just to, I'm sorry, I can see that Dr. Mohammad's got his hand up, so I will stop in a sec. But just to add to that, the role of public health and Michelle's role is around looking at the data, looking at the population level need, and then commissioning public health services. So that process around understanding the population, understanding where there's the risk factors and where there's the decay and what our priorities are, and then commissioning the services is absolutely what we should be doing.
Thank you. Dr. Mohammed? Oh, I'll come bring you back. Okay, Dr. Mohammed, thank you.
Yeah, that's hi, can you hear me?
Yeah.
Okay, hi. Thank you very much for this informative report on the obesity. I was just wondering if we have statistics to show differences in children obesity by ethnic group, and if so, have we identified perhaps those ethnicities at which probably are most at risk in town, and have we put a plan, specific plan, to target those children. So, sorry, my question is quite, to talk about statistics, if we have statistics by ethnic group, and then have we identified those at most at risk, and then have we identified and put together a plan to target those children in schools. I talk about this from the standpoint that Luton is super diverse town, as we all appreciate. And I think diversity is a wonderful thing, but then of course we need, as Sally mentioned, we tailor those solutions, understand the stakeholders that we are putting those solutions in for. So thank you. That's my question.
So the NCMP data, we should be able to analyse it by ethnicity. We didn't need to do it. We've just got the new data set. We just need to do that deep dive piece of work where you can break it down by, you can do the heat maps and the ethnicity. So we need to do a bit more further work on that. The new data that's coming through around the increase in overweight and severely overweight just in the most recent months is quite new. And we're really seeing that increase, as Michelle outlined. So we really need to now be quite quickly working out what actions we need to put in place to tackle that emerging priority issue. We had actions already in place through the Child Healthy Weight strategy, but we really need to refocus on this now in light of COVID. Michelle, is there anything else from your side on that?
No, I was just looking at the strategy. So yeah, I think part of the action plan was around kind of ethnicity and how we can work with different sort of communities, so and people's different environments, because every family will have a different, I suppose, take and understanding of healthy eating. So it's how we can work with those and engage with them. So when we can have an offer a more sort of targeted approach. So we are aware of that, and our wellbeing service, Total Wellbeing, and sort of Active Luton, who run our Child Healthy Weight programme, are aware of that as well. So we wanted to do some sort of targeted work. So I can have a look at the NCMP data, because I think you can drill down and pull out the ethnicities. So I haven't had a look at that, a chance to look at that, but I'm happy to do that.
So, sorry to create more work for you, Michelle.
No, it's all right. It's on my to-do list.
No, we need to do that.
Thank you.
Councillor Wahid.
Thank you, Chair. Thank you for your reports. I just want to ask you a couple of questions about tooth decay. You know, tooth decay is unpreventable, and it's not good like when they're 5-year-olds, you know, and you pick it up. 3 years, when they're 3 years, they go to a nursery. They attend nursery. There's a family workers there. I know, the children's centres are wonderful, and we haven't got the resources, have it. So why can't we use the school? Because these children are still not full-time school, they are part-time school. And pick it up from there and work with the family workers and the parents, and have an incentive, that have a reward chart at the end of the week, that, if you're doing this right and this, and, give them toothbrushes and toothpastes or anything else, that you can reward them with.
Should I answer that? So we're working at different stages. So we've got health visitors going in at their 12-month check, and working with the families and giving toothbrushes to that child and any siblings. Then also our early year settings, and our maintained nurseries. So we've looked at the in the wards that I mentioned earlier, so that will be at age 3 and 4, and then again at reception at age 5. So we've got a kind of staggered approach, but part of the approach is to get fluoride in the children's mouth, but also that healthy lives approach. So it's like a Healthy Smiles Award, so that schools, early year settings and families understand kind of the importance of healthy eating, brushing your teeth, the amount of toothpaste to use. So we give them sort of top tips. So we're trying to have a staggered approach every kind of age bracket that is a useful point for sort of those key interventions.
Thank you for that. Can I just another question? And can you give us like the breakdown of the ethnicity as well, so we know which, ethnicity is more affected, so we can work and target them.
I think with the oral health, that's in the oral health needs assessment. So there was a lot of work done to kind of break down on ethnicities. So I think it is in there. That's part of the report. So we are looking at ways that we can actually work with those families, because different cultures have different, obviously, way that they foods they eat, or kind of ways of brushing their teeth. And the other thing as well, I think that we're trying to support with is making sure people can access dental services as well, access dentists. I know that's been a bit of a problem.
Thank
you. Councillor Lovell.
Thanks for the report, and it is quite concerning with the oral health, and just wanted to ask Chair that if we could have a report back later on in the year, how these options and actions, how they've played in the year, just to see how they're getting on. Yeah, because it's quite concerning.
Yeah, absolutely. I agree. I think we do need to add this to the future work plan to come back on both the dental decay and the obesity figures. Yeah.
Thanks, Chair.
Is it okay if I just come in on that point?
Yeah, certainly. Go ahead. Yeah.
Very happy to bring further reports back. Absolutely. Just a word of caution and reality around some of these figures, and the prevalence figures particularly are not a quick fix. So just sort of managing expectations. The actions that we take forward, the impact that they will have will be long term. So, the prevalence of tooth decay in under fives being at 38%, the shift on that will be slow. So don't expect a shift on that quickly, but the actions that we will be delivering, we can certainly update on.
Thank you. Terry?
I just want to know, what age do you stop monitoring obesity?
So the so the National Childhood Measurement Programme is a national programme, a statutory programme of work where they go in and measure reception in year 6. So we have really good data that enables us to take action because of that programme. So the detailed data that we have on childhood obesity is specifically reception and year 6.
That's the last year of primary.
Yeah. And you see a really big in Luton and nationally, but it's particularly apparent in Luton. You see a really big difference between the reception and the year 6 prevalence of obesity. So we're above the national average in reception, and then we increase even that gap even more. So we're quite substantially above the national average in year 6. So the proportion of children who are obese is really increases into year 6.
So what happens to the children from, 10 years on, 10 years of age? Are they just left after that, or?
No, they're not left. So there's still programmes of work, but the measurement doesn't happen. The measurement happens in year 6, and if they need to be referred to weight management services as part of that measurement programme, so that those that are identified as overweight or obese in that measurement programme are referred to weight management services and monitored through there, and that will continue if needs be. So there isn't the further structured way of identifying those children in the same way beyond year 6, but children can be referred into child weight management programmes, the support in schools, the schools-based activity programmes.
We don't ever get a report then on children's obesity from 10 years on.
We just don't have the data. It's nationally, the programme is measuring in reception in year 6, and that's the way we're structured.
Half-hearted, isn't it, really? Because a lot of obesity does come on from the years 10 onwards.
The rationale is that this sets the trajectory. So those that are overweight in year 6, it's about trying to catch them early to then be able to take actions prior to them having more problems later on in their teens. So it's when obesity, overweight starts is really why you see that difference, is because it starts in year 6, so we can do that early intervention in year 6 and hopefully prevent further development of that going into secondary school.
It seems to me you're cutting off too soon, because after the age of 10, children start to worry about their weight. We all know this, don't we? And they're just being left after this. We're okay up to 10, but after that, goodbye.
I mean, I guess what I'm taking from this is that this is a national decision, that this is how it's measured. Is there any way that this can be influenced locally, or Health England can be influenced to change their measure?
I mean, it can be raised, and it's something we can look at and discuss. But I think, as I said, the rationale is about, you're right, after age 10, that's when the body consciousness and some of the challenges happen. So it's about catching it before that point. So it's about early intervention, identification of getting into that overweight category but not yet obese, and taking action at that point. And then if those children are within the system at that point, then they would still be being monitored for impact of the weight management services. So there is a
Can I just say as well, yeah, so they will get picked up if they're referred into a tier 3 service, and they've they can be referred into that service at whatever age. The same, they can be referred into our total wellbeing weight management program at any age, and they'll have some continual growth monitoring after that. So there'll be different interventions that potentially would be going into school to support those children at sort of at different ages. But yeah, the national programme is just reception and year 6, and there's probably actually children in years 1 and 2 and 3 that actually, I would say, that probably needs to be measured, weighed and measured then, rather than after year 6. The other thing that we're doing, I did put it on my report, I forgot to mention, is we're trying to link it into our holiday activity and food programme. So we had some money from some funding from the Department for Education to run holidays, activity and food last year, and we've got funding for the next 3 years. It's mainly focused for children on free school meals, but this year we can set aside some of our funding to focus on different areas, and one of the key areas that we've said we wanted to focus on is children that are overweight or severely overweight, so they can access these sessions through Energise, Luton at Easter, summer and Christmas, and they're like whole day sessions, providing physical activity and a healthy meal as well. So we're kind of trying to have that sort of layered approach. So and then if children need to be referred into our weight management services, they can. So there's a bigger system of support there for our children and our families.
Just curious, what usually prompts referral to these weight management services? Is it the data from year 6, or is it GP, schools, or all of the above? I mean, I'm just curious.
It's a mixture. So GPs can refer in, you can make self-referrals, but the majority probably that we're seeing are the referrals from the National Child Measurement Programme data. So if a child is weighed and measured and they fall into the overweight or the severely overweight categories, that their details are sent to Total Wellbeing. A letter is sent to the parents saying what centile their child's on, and then Total Wellbeing will contact the parents and engage and see if they want to join our one of the programmes. So we've got enough capacity in our total wellbeing for our overweight children. We'd have a little bit of drop off because not every family or child will engage with that programme, but it's our children in our probably in the severely overweight, those that are most at need. We need that access to kind of a more holistic approach and kind of a part sort of multidisciplinary approach where health, public health, safeguarding, etc., mental health are all involved.
Thank you. Apologies if this is in the report, it might well be, but do we know what's the percentage uptake in terms of parents and their children sort of taking part after being referred?
I think there's about a 10% drop off. So the uptake's not much. I'm trying to think, actually might be 80%. That's not my service. So it's about a 20% drop off. It's fairly high compared to other areas.
Yeah, it's quite a good uptake, actually. Good. Thank you, Councillor Lovell.
Thanks, Chair. Just wanted to find out about the water fluoridation scheme in Luton, and can we have one?
Do you want to answer that, Sally? We don't have one.
I think this might have come up in the last one we came as well. Actually, it's a difficult one. There is a strong evidence base for it, but obviously it's quite sort of nationally political and locally it's not all within our control. So we could lobby and we could develop a position statement on our view on it, but actually it's not that easy to make that change. It's not all within our gift. But you know, there's discussions that we could have on it and advice and guidance that we can start issuing on it if it's something that we want to pursue, but it's not an easy fix.
Yeah, but just looking at the figures that we're looking at now, you know, for Luton, would that not be, you know, a case for us to push for that, Sally, at all?
We can have a look at it. I think prior to me being here, there was some work done on that evidence base and process previously, so we can have a look at what work was carried out previously and where it got to around the conversations nationally and regionally on that.
Yeah, I was just checking earlier, and there's a recent update on, I think, 23rd of February on that as well, by one Dr. Nigel Carter.
On national position.
Yes, I think it's from the Oral Health Foundation, about how important it is for children. So if it's something that, you know, we could, you know, lobby, as you say, on that, I think probably a good direction to go, you know, with the figures that we're looking at. Yeah, for Luton, it's not good. Thank you.
Okay, we'll take that away. Thank you.
Thank you. Any other questions, Terry?
I'm sorry to keep harping on it, but I'm a bit concerned about the fact that we don't monitor our children after the age of 10. Is there no report anywhere that comes to council at all about obesity in 10 and upwards? Or is it just forgotten about?
It's certainly not forgotten about, but we just don't have the detailed data on that. If we were going to have prevalence and data at the different ages, we'd have to commission an additional child measurement programme like the national one, going into every school and weighing and measuring every child in the same way that they do for the national programme. So it would be quite a large undertaking to get that data, and actually the Year 6 data helps direct our actions and services. There's always more that we could be doing, but we don't have that level of local data beyond 10.
Well, I must admit I'm a bit concerned that we're not geared up to looking after our teenagers, which is what it basically boils down to. And I'm sorry, you worried me slightly, to be quite honest.
It's not that we're not geared up, it's just we don't measure them like officially after Year 6. So there are services and support and interventions in place, and we'd rather spend our resources on providing that than, as Sally said, to go out and put a new programme in place to measure, I don't know, year 8 or year 9 would be, but it would be very costly and we wouldn't have the resources to do that. At the moment, our school nurse team undertake the National Child Measurement Programme measurements for us. They don't have capacity to do that in addition. And actually after a certain age, there's something about children sort of self-weighing and kind of engaging in programmes in a different way. So it's not that we've forgotten about them and left them. There is a lot of support out there for children. It's just that they're not weighed. And if they were weighed, we wouldn't have any national or local data to compare it with. So it wouldn't be very strong data to rely on.
And just sorry, just last point on that. Just last point on that. What after year 6, when they're measured and weighed, referred into services, they are then in the system and can be followed up. So those children that are overweight at that point are likely to. That's why it's there. It's that early intervention point where we can take action, and then they are in the system. So it's not that they're just dropped off and forgotten about after that point.
So sort of a risk-based approach. So children who are identified as being a higher risk are monitored, but as with any system like that, there is, I guess, a risk that some would slip through the net. Yeah. Okay. Thank you. Any other questions? I can't see a hand up on the screen. No questions, comments? No. Okay. So let me find the beginning of the agenda. So just want to check. I think the recommendations were basically to note the report. So yeah, I think all any no comments outstanding or questions. So we're happy to note the report. Yeah. Okay. Sorry, Councillor Lovell, did you have something?
Come back,
yeah,
later on to see how they're getting on.
Yeah, absolutely. And yeah, we'll have this return and we'll include it in the work plan for a future meeting for sure. Cool. Thank you. Yeah, thank you very much for that report. Thank you. Okay. So moving on to the next item in the agenda, which is the item that was circulated separately as an update. It's item 9, the Social Workers Academy. The report by Daniel Toth. I guess the presentation is by Alison.
Good evening, everyone. I will start to present the report for the Social Work Academy. I would like, first of all, to mention the fact that we had a review of our academy based on the investment that Luton has put into strengthening the practice for children's services. So we looked at 1 year after we've invested the money into the academy, what have we achieved? But before we do that, I would like to just remind ourselves in terms of what the vision was and what the vision is now for the academy, and why we are so proud of what we've achieved in the last year and the forward planning for the academy. So from the beginning, we wanted to make sure that we are attracting and we are developing and we are motivating proactive practitioners to support the most vulnerable children and families in Luton. So that was the mission from the beginning, and we stay with that mission. What we've achieved so far is the strengthening of the practice, attracting newly qualified practitioners to Luton and offer them the opportunity for an entire year to have the intense support from experienced social workers, experienced managers, to work with them to strengthen their confidence to deliver the best services for the, as I said, the vulnerable children and families in Luton. As a bit of a context around the academy, how the academy is structured, it's led by a head of service. I'm overseeing the academy. It has a team manager, has a team of 5 senior practitioners, very experienced social workers, and 2 practice educators. The reason why we have a tight structure around the academies is to have that robust oversight and ability to react quickly to the needs of the service. I would like to take you back now to the vision about the academy moving forward and what do we see as the priorities for the academy. We talked earlier, about the workforce and the recruitment issues, the conversation around the agency workers and the permanent practitioner. So one of the first priority for us and strategic priority is recruitment, as we mentioned before. We have a clear plan of 2 recruitment drives per year. I mentioned about what we've done this January and what we plan to do in August when we are optimistic to attract a significant number of newly qualified practitioners to join as permanent workers in Luton, and that will have a massive impact on the increased number of permanent workers in our services. We strengthened this process by introducing an assessment center as a way of making sure that the match between those candidates, newly qualified practitioners, or those that are planning to join us, they bring the skills, they bring the knowledge, they bring the competence to work in the services where the greater need is. So that is a process where we involve young people, we involved other social workers from the council, we involve managers, and we try to create an environment where we get out the best of those candidates so we can match them with the right services. We've developed the strong links with the university and we continue to build on those strong links with the university. The second important priority for us is the retention. It's all good to bring people to Luton, but it's important to make sure that we keep them in Luton. And I think that priority is embedded in every single senior practitioner, manager, and a deputy team manager within our services. We need to do more to retain the practitioners in Luton. There is still more to do in that respect, but we have a robust induction program for the newly qualified practitioners. We have clear training opportunities for them, and as a part of our strategy, as a way of strengthening our position with the workforce, which is our third priority. We are bringing into the Social Work Academy the principal social worker role, which currently sits in another part of the department, but the view is to bring very experienced person that operates at the level of a senior team manager or service manager that can oversee the whole learning and development of the workforce within children's services and be the link with the universities, develop new plans for continuous growth of our workforce. So 3 major priorities: recruitment, retention, and workforce development. That's what the academy works with, and this is our plan for the next year. I mentioned a bit about the structure, the roles. You'll have in my report the description and the details of each role within the academy and what we want to achieve with those particular roles. But I think it's important to talk about the fact that we have a really strong opportunities with our academy to strengthen the quality of the service that we deliver to vulnerable children and families. And as Ofsted has indicated in their latest visit, there is a significant investment that we've all agreed to put into children's services through the academy, and that is demonstrating impact. We are not there yet in terms of what we want to achieve, but definitely the quality of the practice of those newly qualified social workers is changing through the intense support that they are receiving from the senior practitioners and from the academy overall. I think the targets for increasing the numbers you'll see on my report, we are optimistic that we can increase to 32 newly qualified social workers by the end of the year, and that will put us in a very strong position in terms of permanent workforce. That's our future as practitioners, and those are the social workers that we need to invest the most in terms of training, supervision, induction, support, so they can stay with us on long term, and as the chairman mentioned earlier, prevent those constant changes for children and families, constant changes in practitioners. I think our data is quite strong when it comes to our capacity to retain the newly qualified, the ASYEs as we call them. But there are still some further work that we need to do in terms of making sure that the percentage of those ASYEs that remain in Luton stays consistent at over 85%. Any questions?
Thanks. Well, I think this is a really good scheme. It's great to see a sort of bringing new social workers into the system and boosting our permanent staff in that way. I think it's great. Couple of questions, if I may. So before I open it up to the floor, on the last page of your report under future plan, obviously you've put a list of numbers of ASYEs that would be in each of these teams. Are they in these teams for the whole year, or do they do a few months and then go to one of the other teams to get a broader experience? How does that work?
At this moment, the numbers you will see there for each service or team, it's a number that stays the same through the assess and support year in employment. But the learning opportunities that they will have within that period of time, it will vary, and it depends on the needs of each individual newly qualified practitioner, because some of them come with prior experience, and we try to match them with the services based on their experience. But if we identify a gap in their development that will require exposure to another service, we'll offer that opportunity for shadowing, offer opportunity for transferring between services. And we have examples where newly qualified practitioners, after a certain amount of months in a service, they wanted to expand their knowledge, their abilities, and they requested a transfer to another service. We analyze each request individually, and we come together as heads of service to decide where the best fit and match is. And we help practitioners to move to the right services as a way of making sure that their motivation remains strong and we do not lose practitioners in that process.
Thank you. And I noticed you're aiming for an 85% retention rate, which is a good target. What do you think would be your main challenges in meeting that?
I suppose there are some unpredictable variables that we cannot control, as the pandemic is one of them. And unfortunately, what we've seen last year, for example, and I can talk because it happened in my own service, with all the goodwill in the world, we try to retain a newly qualified, but because of the circumstances around her own family and the impact of the COVID-19 on her family, she had to finish her involvement with Luton. But I think a challenge will be indeed the context of what's happening in the wider society around people moving to different areas based on their own life circumstances. But at the same time, I think a challenge for us could be a reduction in investment in the academy. So we will not be able to, if we are not in a position to continue to support people, they will leave, because there is a on the market at this moment, there are a lot of opportunities for newly qualified to go to places where they are best supported. I think a challenge for us, it will be to continuously innovate in how we support them and how bring creative ways of motivating practitioners to see Luton as an attractive employer and a place where they can flourish and they can give their best.
Okay, and last question from me before I open it up to the floor. I mean, under recommendations, point 3, it says continue to support the workforce strategy. So I guess my question is, what can we do to support that?
Keep the investment. Or increase the investment, I should say.
Absolutely. Okay, thank you. Questions from the floor? Terry?
You look straight at me, don't you? Sorry, I shan't keep you too long. It's pancake day, isn't it? We want the pancakes. This is good. I like this. We're going in the right direction. Well done. Well done. My only comment is really, we're back to abbreviations on everything. I have got the rest of the people to stop doing this, and Paul actually sent me a glossary, but none of these are actually on the glossary. What's an IRO, a TM, a DTM, an SW?
Apologies for that. You have a perfect point there in terms of using the language that we use between ourselves as practitioners. I'm more than happy to explain each one of the abbreviations you'll see on my report. An IRO is an independent reviewing officer. You'll see the CWD, Children with Disability Team. DTM is a deputy team manager. TM is a team manager. MESH is a multi-agency safeguarding hub. ASY, assessed and support year in employment. I'll make sure next time we'll remove them. But thank you for the feedback.
I'm still not sure what an ASYE is. What's it stand for?
Yeah, I mentioned that is assessed and supported year in employment.
Oh, what? Sorry.
Assessed and supported year in employment.
Oh, right. Yeah, okay.
It's the social workers who are in the academy. So they're supported for a year. Is that right?
That's correct, yes.
It's basically like a year apprenticeship, if you like.
It is. We can call them newly qualified practitioners. Thank you. Thank you.
Councillor Lover?
Well, just to echo what my colleagues just said as well about the hard work, and well done. I mean, the Social Work Academy is something that really interests me, and I'm really happy to see it going from strength to strength. And well done for all the hard work and going forward. Just wanted to ask about the areas for further development. Is this to consider a 3-year commitment?
Yes, I think that refers to our contractual relationship with the newly qualified practitioners, and one of our ambition is to create a space for them to commit to a longer year than just the first 12 months. And our ambition is to have their commitment at the beginning for at least 3 years to remain with us, to give their best for them to challenge us, to train them, equip them, and support them for 3 years, to give them that opportunity at the end of the 3 years to step into management positions or in senior position in frontline practice. So that's the vision of long-term vision, is to have people committing to work with us, not just on a 12 months training or supported program, but actually longer than that.
Would you consider extending that as well? Because I'm thinking that by the end of the 3 years, if they wanted to leave, then are we not back?
I suppose it's rather difficult and challenging to have a larger time frame for a commitment like that, because at the end of the day, each practitioner can decide if they want to remain in a place where they feel supported and valued. I think the challenge is for us in conversation with our HR colleagues. We are exploring best ways of incentivizing, motivating practitioners to remain within our frontline practice and give their best without necessarily being tied down because of a contract.
Councillor Wahid.
Thank you, Chair. What does Scrum sessions mean? SCRUM, page 9.
Yes, thank you for that. I've made a mental note for myself not to include acronyms in the future, but Scrum is a methodology from project management that helps people to improve performance and throughput. The term comes from rugby actually, and it's coming together. Yes, it's a daily stand-up. It's coming together to discuss what impediments we can remove and what can we do to improve our throughput every single day.
Thank you. I see no hands up on the screen and no one's trying to attract my attention in the room now. We'll just looking at the recommendations. So the recommendations are that members are recommended to continue with the Social Work Academy, consider roles and strengthening, and continue to support the workforce support strategy, which I'm certainly in favour of. Are we all in agreement? Great, thank you. So that's agreed. Thank you, Daniel, for your report and information. Okay, so moving on to the almost the final item of the agenda, item 10, which is to look at the draft work programme. That's on pages 120 to 126 in your agenda pack. So for the next meeting on the 12th of April, we have the behaviour wellbeing strategy and breakdown by ethnicity for exclusion rates, family, drugs and alcohol court, and an in-depth review of the housing protocol between children's services and housing. Do we have any questions or comments or proposals from the floor on that? Great, thank you. Amanda and I, we will be meeting to discuss the plan going forward. I think that's as far as we could go because we're waiting for the calendar for the next year. But we'll update members as we develop the forward plan further. Amanda, do you have anything on that? No. Okay, so we don't have anything under item 11, so I think we can close